Hello, I'm Dean LeBlanc, founder of Harvest Kernel, and welcome to the Daily Seed. Again, this channel is part of the Harvest Kernel ecosystem. Each day, I plant one idea about AI, learning, and modern life, one seed at a time. Today's seed comes from a blog post I just posted on harvestkernel.com, and it focuses on the number that should stop all of us in our tracks. Before Chat GPT Health even launched, more than 40 million people were already asking Chat GPT Health questions every single day, including me. That number is not curiosity. That is clearly a signal. When that many people turn to AI for medical guidance, we are not just looking at a technology story. We are looking at a literacy crisis. So let's focus on core ideas. Core idea number one, this is about access, not preference. Most people are not choosing AI because they prefer it to doctors. They are choosing it because they cannot access doctors. As we all have found out, appointments are short, specialists take months, insurance creates friction. High healthcare costs create hesitation. In that environment, an AI that responds instantly and never rushes you becomes increasingly appealing. Chat GPT Health did not create this demand. Let's be clear. It revealed demand that already exists. Let's talk about core idea number two. A massive trust transfer is happening. With Chat GPT Health, people can now connect medical records, wellness data, nutrition apps, and more directly to an AI system. That represents a huge trust transfer. People are simply handing over their most private information to a system they do not fully understand. Most users cannot explain how large language models even work. They do not understand hallucinations. They do not know the difference between pattern recognition and medical reasoning. So trusting without literacy is truly a risk. And lastly, core idea number three, regulation is moving faster than education. We're seeing this in all industries, and the healthcare industry is no exception. But here's the part that worries me the most. Regulation is accelerating. AI is being allowed into healthcare workflows. Some states are already permitting AI-driven prescription renewals. At the same time, education itself is lacking and lagging badly. When technology moves faster than the understanding, people become very vulnerable. Healthcare AI will expand whether we are ready or not. The only variable that we still influence is literacy. So here's today's seed. AI in healthcare is not the problem. It's using AI without understanding its limitation is. Literacy is not about becoming an expert. It's about knowing when AI can help, when it can't help, and when human judgment is critical. If this idea resonates with you, I go much deeper in the full blog at harvestkernel.com, where I break down things like AI literacy, and what it looks like not only from the healthcare standpoint, but why this moment really matters, and how educators, parents, professionals can respond without being overwhelmed. Remember, the Daily Seed is about planting the idea. Harvest Kernel is where we will cultivate those ideas. And that's today's seed. Take care.